Good morning, everybody. Well, sip your coffee this morning and get ready to absorb the fundamentals of this important subsection of our aging demographic. We have a big onion to peel today. We're talking about a demographic hidden in plain sight. We're talking about solo agers. As we look inside of our aging population, we're going to find out what's known about aging and their challenges, even the assumptions that hold nuances for the solo ager. We're going to pull out solo aging information, the truths and the challenges. I'll be going over the definitions, the one you might expect, and the one that is expanded. Now, you're going to learn to identify solo agers. You may even self-identify. If you will, please save your questions to the time that we have dedicated at the end of this presentation. Plus, I invite all emails from you as follow-up. So who's your speaker? Well, I'm a patient advocate who specializes in aging strategy, and I'm a former founder, owner of a patient agency in Raleigh, North Carolina called Navigate NC. In late 2022, I moved to South Carolina and I shifted my practice to consulting online, kind of telehealth style. And nowadays, I'm pleased to speak and teach on a lot of issues like solo aging that we're working on today. Now, what qualifies me to speak is that I've worked with this population for several years as a patient advocate, and I'm among a collective of thought leaders, the speakers and the authors who've been meeting monthly for over 2 years to help move the needle and shine a light on what we're talking about today. I guess the best qualifier I can tell you is that I am a solo ager. Let's get started with the working definition. This is why we're here today. A couple of things that you're going to, fundamentals that you should know. You'll hear me use both solo ager and solo today. I kind of use them both interchangeably. And the other thing you must know is, and carry with you, is this working definition, that solo agers are individuals who by choice or circumstances function without the support system traditionally provided by family. Now that conjures up several characteristics that have been identified for a solo ager, such as people who live alone, people who have no spouse or partner, people without living children or stepchildren, people whose child is disabled and may be lacking the capacity to provide support. But it's actually a much broader definition. Well, you may have family, but they don't live nearby, that far-flung family, or your loved ones may be deployed. We live all over the globe now. And as many of you know or have experienced, there are challenges to long-distance caregiving, or perhaps maybe they're unable. You might have family, but they're unable to help. And this is equally important. They're not the best ones for the job. Your child may be irresponsible or addicted or have a disability or impairment that interferes with their being able to help. Another way to look at unable, the family that we designated, say in 1993, might change physically or cognitively over time. What happens if life shows up for the person you're counting on? If they grow to have their own challenges, like I can't lift right now, I can't drive, I'm unable to do laundry for you. And then there's unavailable. You may have children, you may have siblings, but they're unavailable. For example, you might need me, but I'm having my own hip replacement over here. And unwilling in caregiving, many well-meaning people reach a point where they're just burned out, or they've always been aloof, or they flat out refuse. Now, another part of the expanded definitions is on the slide. Anybody notice on the slide that there's a couple there? Well, this is a duo. Now, anybody living through the 1990s may remember that term DINK, double income, no kids. Well, nowadays we call them duos. You know? But anybody, the point is that duos and dinks are feeling it. You know, they're seeing it among their friends who are rushing to care for aging parents, and they're thinking, oh, well, what's going to happen to us? Or what's going to happen to me? Where do we find or where do we see solos? Let's spend a minute on that. Well, solos can be male or female. Perhaps they're here among us in this webinar, but where else? How about work? How about in your neighborhood? Friends of your elders may be solo agers. My grandmother had a friend named Mrs. Ballard. She was always around all my childhood, and then I realized there was not a Mr. Ballard. Mrs. Ballard was a solo ager. You know, your BFF can be a solo. Who is your spinster relative? Could be a solo. Could be me. Upstairs in your apartment building, the people that live down the street. It could be a cashier, a police officer, a government worker, your doctor, anybody. Did you know that a person could be intermittently or temporarily solo? Everybody feels like a solo on the day of their colonoscopy. But if we're not planning for this, then life is going to throw us curveballs and we find ourselves without support. But seriously, who will you choose to go with you to your colonoscopy and stay with you, or they won't do the procedure and get you home and get you settled? Then there's suddenly solos. When one part of a couple passes away, or when one part of a couple has a catastrophic illness leaving the other one to fend, for all practical purposes, then they're suddenly solo. But what if your support persons are traveling or injured or self-quarantining with COVID or down with the flu? What if they're unreachable? You know, like those folks that go on cruises in international waters. Long-distance caregivers may be out of the area. Maybe you're restricted from lifting or bending or stooping. Maybe it just turns out that they're the wrong person for the job. And one time I was given a similar presentation to this, and the attendees were filing into the room to find their seats, and this couple came in, and the husband announced loudly, "I don't know why we got to be here. This is about solo aging, and we're married." And his wife stood up in full earshot of everyone in the room and said, "Look, when one of us goes, the other one's going to have to know this stuff." Well, she pretty much handed me the room for that presentation. You know, and then there's that lame joke about the wife speaking to her husband, and she says, "When one of us dies, I'm going to Florida." But stories like these remind us all that we're aging. Anybody here not aging? All of us should plan and prepare to be alone. At some point, we will be, unless you and your significant other somehow perish at the same time. Let's talk about the numbers of solo aging. The Mathers Institute, drawing from the U.S. Census 2021, says there are 22.1 million solo agers in America, 28% of older adults. In their 2020 study, the Pew Research Center found that 27% of persons over the age of 60 and older living in the United States are living alone. Now, this is higher than the global average, which is about 16%, but very similar to what we see in North America. The Pew Research Center also projects that this number will increase as the baby boomer generation retires. An important fact among research is that the majority are women, and we'll be taking a closer look at that shortly. You know, they say that the devil's in the details. Well, in this case, the devil's in the definition and how we measure our numbers. it's kind of hard to get clear data when what we're studying is 65 and up, 55 plus, 60 and older, 50 and up, living alone, head of household, not married, not partnered. And what about that expanded definition that we all just embraced? Our measurements are all over the place, and so the data rendered can be also. No wonder solo agers have been hidden in plain sight. No wonder there's an incomplete view of this population. But what we do know is that it's going to increase. We do know that more are coming or will be uncovered despite our wacky measurements. And it's important that you and I realize that this demographic is going to grow. A growing number of solo agers will be identified or will self-identify, and they will seek help. Now, here's the very first identification of a solo ager. It was from research done by Dr. Mariah Carney back in 2016. She coined the phrase, more than 1 in 5 Americans older than 65 are at risk of becoming elder orphans. And she said that in 2016. Now, in my opinion, there's some unfortunate words in that phrase that have stuck with us for many years. 2 parts. The elder orphan is, to me, damaging language-wise. It conjures us up as waifs. But Dr. Carney was already seeing the challenges and calling that to the fore in 2016, so we thank her for that. The other part of that phrase that I don't like is at risk. I don't see this as risk. I see it as opportunity. It's a big call to action for us. Now, we solos or solo agers have a lot of monikers. Well, a lot of names have been assigned to us during our short evolution. The first one was elder orphan. And then there's unrepresented. That's the term you'll hear in the legal arena. Or maybe unaccompanied when you're in the ER or in the hospital. Unbefriended was a term hung on us by our own American Geriatric Society. Gee, thanks. And kinless came up a couple of years back. But even tagging on the less to kinless bothers me. You know, language is so important in aging and in healthcare, and I think you'll agree. But somehow we got from elder orphans to solo seniors to solo agers, and now some just call us simply solos. We're similar to regular agers, but not. A couple of things that we know to be true about aging. We know that women live longer. We have a longer lifespan, and so there's going to be more female solo agers than male. And more live alone. I already mentioned that Pew Research Center study that 27%, and Mather's following up with 28% of American seniors live alone. Well, how does this affect solo agers, many of whom are women? All that plays out into this phenomenon that I have dubbed with a very clinical name, the whammy. And the whammy goes like this. Now, it's a given that women live longer. During their work careers, they may stop work to bear and raise children. And that results in lost wages, gaps in earning, gaps in contributing to retirement and to Social Security contribution. And they'll return to the workforce with a big fat gap in their employment to explain. And so they may earn less money or have rusty skills, and that likely results in a lesser wage. Years go by and they may stop work again. At what time in their career? They're going to stop to help aging parents when they're in their peak earning years. Again, resulting in less contribution to retirement, pension, stopping the Social Security contributions for a while, and that's going to come back to bite them in retirement. There'll be less Social Security accrued, so you're going to have a lesser Social Security check. Now, the whammy is not only a women's phenomenon, but there are more older women than men in this social circumstance. And we got challenges like most regular agers. A percentage of solo agers have taken no action to plan. They're in denial or delaying those conversations. And lack of planning is going to leave you unprepared. Now, the problem is for any ager that their world is getting smaller at a time that it needs to expand. We all need to build teams and to build community. Build, not dwindle. Not a month goes by that I don't get a call about somebody saying, you know, I don't have anybody to name as an emergency contact, so I can move into that senior community or go on that trip. Or they say, I don't know how to meet people. Or all my friends have moved to be closer to their kids or into senior living. I don't have anybody to designate as my agent or proxy with healthcare power of attorney or financial power of attorney. Now, I have no ride to medical appointments, so I might skip it. And then their health suffers. We all hear a lot of talk today, a lot of news about isolation and loneliness. Whenever I speak, I like to take just a moment of reverence for everybody that was affected by the pandemic. Go with me there for a moment now. What we all went through, alone and many without support systems built, and we'll call that a yet. Many solo agers did not fare well. As a solo ager myself, I was my own pod during that long time, and I can tell you, at times it wasn't easy. But many of us know all the talk and the research on isolation and loneliness that is coming out, and it rings true. Does everybody here know that in May of 2023, our Surgeon General, Dr. Vivek Murthy, declared loneliness to be an epidemic? Now, there are positives. Few articles that you'll see will tout this. The headlines certainly don't. They suggest that we're needy. But I and many of solo agers will tell you they love the freedom. They love the self-determination. They are not stuck with blood family members nor obligated to deal with them or care for them. They get to choose their family, and that's an important concept. There's a lot of power in choosing your family. They get to travel and live their lives untethered, unconstrained by obligations that many normal families have. They need only make themselves safe and happy. And the challenges, the similar but different, continues on too. There's legal and practical considerations. I had two of my students were out talking in the hallway one day before a class, and one of them looked at the other and said, Madge, which one of us do you think is going to keep our marbles the longest? And while that question made us all smile, those were two solos in their 60s talking in the hallway. Now, that question was poignant. It's one thing when you're 68, but when they're 78, there may be very different answers. And when they're 88, that marbles question will likely have very different answers. So for solo agers, legal and financial decisions are key. Like other regular agers, solos still have to think and learn and decide and document and discuss their legal planning with their VIPs, their very important persons, just differently with different factors. I like to say we need to plan specially, and we especially need to plan. Advanced directives pose real challenges for solos. It's harder without that built-in family. Often, solo agers have nobody to designate as their emergency contact in a medical or a housing situation. For travel or group tours, nobody's named to place on the form, much less act on their behalf. There's often nobody to designate as agent or proxy with healthcare power of attorney. And you know, a patient advocate thinks that's important work. Or durable or financial power of attorney. Solos grapple with this. And then there's the executor. How about logistics? You know, rides to that colonoscopy and to remain with you. And what about getting you to the pharmacy afterwards or getting groceries in? And who's going to walk Fluffy the dog if you can't? And also, middle of the night person. That's the person you're going to call at 3 a.m. if you have a need. Who can you call in the emergency? We all need to identify one. Have y'all got one right now? Solo agers need a middle of the night person. I bet everybody's thinking right now, oh my, do I have a middle of the night person? Living arrangements sometimes can be a challenge for solo agers. You know, most folks say they want to remain in their home, but it's not for everyone a practical forever solution. There's a lot of chatter about this online in Facebook groups and forums among solo agers who are looking for housing models that suit them, that are a fit. In our lifetimes, you and I know how much senior housing has changed. And I like to think that baby boomers and solo agers are helping to drive that change. The Golden Girl model is seeing a big revival right now. And I think that's because we solo agers know that we need community. And that's a nice segue into our next slide and into solutions. Community. Community is key. We solo agers know we need that, and for all the right reasons. Community is crucial for everybody, from combating the loneliness to camaraderie to rides to the colonoscopy. There are solutions in community. And this next thing, interdependence. Well, let's spend a moment on the concept of interdependence. There's a lot of solutions in solo aging, and much of it starts with perception and thinking. We'd all be well served to understand the distinct differences between dependent, independent, and interdependent. Now, I'll bet you've all heard or said the following statement: I don't want to be a burden. When you hear, I don't want to be a burden, what you're really hearing is, I don't want to be dependent. That's a key phrase for all of us to hear or to say. Plenty of people have never contemplated the concept of interdependence. It's a solution interdependence. It's the dependence of two or more people on each other, like social connectedness, mutuality, reciprocity. For example, two people, one needs a ride, the other one can drive. Or I help you, you help me. In my own story, I'm helping somebody who is currently in a surgical boot. Same person drove me to my surgery last year. Now, many people have to learn that interdependence is a good thing, that relying on others, it's hard. It doesn't come easily to older adults, but interdependence is a means to an end. If you are a professional watching with us today, then consider that your services could be in need of a type of interdependence. If you're a solo ager, and that means tapping into these services that professionals provide for you, is a way to gain support, and that's interdependence. So I'm going to say this next part really slowly for your consideration, or so you can jot it down. Interdependence removes dependence. and still allows for interdependence. Interdependence removes dependence. It allows for, and I said it wrong the first time, interdependence removes dependence, and it allows for independence. That's a lesson I had to learn last year. I was to have surgery and I needed to get there. I needed help to fan out my information to all my very important persons, give them updates. I needed light help or a go-to person to help me in my recovery. And this overly dependent gal, I had to learn that interdependence was the ticket. In the process, I didn't lose me. I didn't lose my independence. I flourished with the help of my team. So here comes another concept for everybody to consider. The microboard concept. Think of your solo aging friend, relative, client, or yourself who needs a circle of care, a village. They need to build a team. For this presentation, we can use Wanda there. Wanda needs to build a microboard. She is a solo who lives alone with her dog, Caesar. Wanda is 74. She drives for now. She'll tell you, I don't have any way to meet people. So this designation of power of attorney thing is a problem. I don't have a 3 a.m. person. I need help with rides to the doctor. Mobility issues are with Wanda. It helps her, it hurts her in grocery shopping. Going to appointments is just getting harder. She uses a rollator, and that's a pain getting in and out of the car, and she's just tired. And she's starting to think now, how will I manage all this? Who will look in on me? The thought of moving may just be coming on to her radar. So let's think about what you or Wanda might need to consider. Now, y'all, I get all excited about this part because I love to live in solution and to celebrate the fact that we have so many options. All of us, but most importantly, senior solo agers need to build a microboard. And here's how it goes. You know, when I use the concept microboard, in my head, I see a conference room table and people around it in seats, appointed seats. Now, Wanda and I are going to give some real thought to all kinds of people that we may need to help things work out in our lives. Everything from the doctor to neighbors to transportation to home care, like visiting angels, and who will walk Fluffy the dog. And this is so cool. The solo ager gets to be the chairperson of their board. They select and fill the chairs on their board. They build their board because they're selecting their team. This is real power. They can seat and they can unseat. And this is big. In building their own microboard, a person independently enters interdependence. So who could be on Wanda's microboard? What are the open chairs? Well, for medical needs, naturally a patient advocate might start with that. Medical, it's our way. But how about a GP? Primary care physician might be the main person to steer, or there may be some specialists too. Wanda has a general practitioner and an endocrinologist for diabetes and weight management, and an orthopedist who's treating her knee and starting to talk surgery. She has a patient advocate to advocate, to educate, to plan or manage any care during treatment. And I'm likely the one that's going to help build the microboard. Then there might be traveling therapies like physical therapy and occupational therapy and home care like visiting angels. What about durable medical equipment? For legal, Now, Wanda has made her designations for healthcare power of attorney and for financial power of attorney recently. Now, she knows to revisit those designations every so often as well, along with her advanced directives. And this is something that I help folks with all the time, the conversation and the education about advanced directives. Well, in the financial arena, Wanda says she has a so-so financial professional, as she puts it, and she may wish to find a new one. She's had a CPA for years to handle taxes, but now she wonders if there's a less formal way of doing things. Her needs are more simple now than when she and her deceased husband had so much going on. She's just learning about this profession or industry called daily money managers. And they're the ones who help with day-to-day budgeting or bill paying or preparation for the taxes, maybe later help with evaluating when a move should come up, what her eligibility may be to enter senior living, etc. Now, for insurance, I went straight to teaching Wanda about an organization called SHIP, 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 State Health Insurance Assistance Program, SHIP. If you Google SHIP, it'll come up. Yours in Maryland and DC is SHIP. In other states, it's SHIIP. But Wanda has a Medicare advisor. She's done another thing right. Over time, she sought out and kind of cultivated a relationship with somebody that she trusts who's an insurance broker, and she'll tell you to do the same. For support, a big category, Wanda's working on choosing her family and extending her support. Remember, it's build, not dwindle. She's looking at faith communities, clergy, faith personnel. Wanda will tell you she wants to find a place to give or put in. She wants to invest before she ever has to take out. She knows me. She's learning about care managers. As for neighbors, well, she says she kind of sort of knows the young couple next door. So there's some work to be done in this department. Wanda needs to meet and know her neighbors, and they need to know her. So there's work to be done here. Now, waiting in the wings, too, Wanda and everybody should also know that there are so many professional organizations like the Veterans Association or the ones associated with a diagnosis like American Cancer Society, American Heart Association, the MS Society, Alzheimer's Association. Please know that whatever your diagnosis, there is a lot of information and support for you. And you can find out about that and bring somebody on your team. And simply and often of great support, let me go back to those good couple of neighbors. You know, a neighbor might be a great person to have on your board. It's a good idea to give before you receive there as well. But if you are an ACAP, adult child with aging parents, get to know your solos neighbors. Trot on over there, introduce yourself, and leave your contact information. You know, create community. And this brings me to two considerations I have for you now. Are you a candidate for a microboard? Are you ready to be of service? You know, I help folks build their microboards all the time, but are you ready to serve your solo? Do you know or do you network with all the folks that are related to microboards to help your solo, to help you or help Wanda? You know all those microboard candidates. Don't you want to be able to say, hey, I know somebody, whatever their need may be? Then we got to keep learning. And for that, we have to keep in touch. Now, I've provided visiting angels with a handout of resources and all of the links that I've been talking about today. So make sure and get your handout. These two books are on it. First, there's Essential Retirement Planning for Agers by Sarah Zeph Geber. And then there's Who Will Take Care of Me When I'm Old by Joy Laverde. These are two thought leaders and authors that you should get to know. The links are on your handout, and you can likely find these books in your public library. I see that much more often than not. And feel free to call me. Count on me as your solo aging expert, your subject matter expert. Check out my really simple business model. I only offer 1-hour consultations, single consultations. And those are for triage, assessing your situation and offering recommendations. Or we can choose one topic to work on and problem solve. Yep, I'm making that a verb. Problem solve. I got a book coming out pretty soon. I've said it. That creates accountability to me when I say that to all of you. But look for my media this summer. The book's about handling emotions of caregiving, something I think all of y'all will relate to. It's about fudge, fear, uncertainty, doubt, guilt, and exhaustion. And visit my social media. You see my website there. My LinkedIn rolls with lots of articles, and you can find out where and when I'm speaking. But let's get connected. Do you want some freebies? I have 2 going on right now that you can download for free. The first one is a sheet called ICE, in case of emergency. For you or somebody you know, you gather your information, and it's a ready sheet. Keep it by the phone or on your fridge. And again, it's for you or somebody that you love. The other one is a free face sheet tool. And that's a great tool to prepare when there's a hospital stay or your upcoming outpatient treatment. This gathers the information and helps everybody keep in the loop. So you'll find these right on my website. And when you get those, you're going to become a member of my community. And I'll send every other week a teaching video for your consideration. You can watch a video, you can listen to it as a podcast, or you can read it as a blog. Consume as you wish. So this concludes my remarks. I got to thank you all for having me here today, and I look forward to this Q&A segment. I hope people have some questions. Anybody have any aha moments or learn something they didn't know today?
Yeah, I am truly, truly, truly thankful for what you've discussed here, Nancy. And of course, I have collected here some questions for you. So, yeah, here's from Carl. How do you feel about the new services for caregiving, handling finances, etc., rather than the traditional trusts that acted as advocates slash checks?
It's almost like you were referring to the daily money manager industry that I mentioned, and they're a rather new industry, as is mine. And I bring them on the team a lot because they can do so much behind the scenes, help people with their budget, or sometimes when cognitive decline is part of the scenario, then maybe we need somebody to prepare the checks ready for your signature, explain the bills so that we keep your billing and your credit good. It's also great for long distance caregiving. If there is confusion from medication or cognitive decline, then it's really great to have somebody to handle that for you, to keep things running in the background so you can live your best life, which is less stress.
Okay, I love that. Anyway, this is from an anonymous attendee. How do we form new relationships that are trustworthy as our contacts shrink, as you mentioned?
That is the evergreen question. And many people are working on this, myself included. In late 2023, I moved to a state where I knew no one, not a soul here. And I'm having to walk my talk. I'm looking at, I like Wanda are looking at faith communities because I do feel a need to put in, to contribute before I take out. So that's one way to step into a pretty big community. but I'm having to make friends. I'm having to put myself in situations where I'm meeting all ages because I'm on the lookout, y'all, for people that are younger than me that are going to keep their marbles longer than I might, because I may need to designate new agent or proxy with my healthcare power of attorney and my financial power of attorney. So I'm looking for people younger than me, responsible folks, fun folks. So I have to go try things. I go to events. I go to a lot of meetup events. Where I live, they have a newcomers to Greenville, South Carolina meetup, and we can all go and talk about how we got here and trade stories of fun or debacle or why we chose where we are. I stepped out on faith when I signed up for an improv class, and we all acted pretty goofy together. Everybody it was a level playing field. Everybody was equally fun and funny. Just had to try some new things. I volunteer a lot. If there's an event going on, then I could take tickets. I could check wristbands. I could man the VIP tent. There's a lot of things you can do, volunteer, and you can find those sites. AARP has a great volunteer route, and sometimes the municipality that you live in, somebody told me, Google Greenville, South Carolina volunteer, boom, we found it. But I Googled also volunteer efforts, volunteer near me, and some stuff came up. So just find something that you like. If you have a cause, I like to work in the food insecurity realm, and I like to go and retrieve food and move that food over to folks that can use it. So I find organizations like that. So find something that floats your boat.
Okay, what a wonderful answer there. Yeah, I'd be using that. I could use that even if I'm, at this age and just start building my, circle as well. Anyway, here's from Carl. Biggest fear as a solo ager is dementia. How do we plan and find reliable, trustworthy resources?
I'm very glad that you asked that, because that's can be a looming reality for many. I again am in my microboard building and my making new friends. I'm looking for people that I can kindle relationships with. I'm looking to find reliable folks, and I talk with my clients about this all the time. Who have I got? How can I find? Where can I go? How do we do this? And we start uncovering, we get in the weeds about how we can find some people to do this. And then sometimes it's just the nerves of kindling a relationship. We're not all in grade school anymore. We're not thrown in the same classroom 8 hours a day with 30 kids. It's harder to meet people as we age, but there are ways to do it. And so that's often the conversation, is how to have the conversation, where to find. And there's some good meat in those conversations. And how do I talk to this Sally person that I barely know? It's like how to make friends all over again. It's a little harder, seems a little weird sometimes, but it's all doable. One good way is to put yourself in a position with the Sallys of the world in a common thing, like volunteering. Let's say you're going to both go on Thursdays and pack boxes for people that need food at the food pantry. You and Sally, you're doing the same thing. You got a level playing ground, but a common interest to build from. And you and Sally become buddies every Thursday. And then you go out to coffee, and then you kindle that relationship. So it all starts humbly and simply and genuinely.
Okay, thank you for that. And our last question for today. I like the concept of microboard. I live in a neighborhood with lots of turnover, young people in first jobs. What do you suggest? Also, what do you see as the role of senior activity centers in building the microboard?
Oh, well, I would say the latter is key too. because they're providing the place. Senior active adult centers are providing the place. We just got to step in the door. They're providing the level place, the level playing field. There's a class you could take. There's an exercise class. There's a line dancing class. There's a chair aerobics class. And this is where you find the mutual people. I have a friend that surprised me by taking a line dancing class. And sure enough, she got to know some of the ladies in the class, and then they went out to coffee. Some of them, the ones that could, the ones, and some couldn't. But sure enough, one of them had to have some hip surgery. Well, they all rallied to help their friend. And who's going to bring a casserole? Who's going to drive her? Who will check in? Who will walk Fluffy the dog? And it happened so organically and genuinely that the friends in her class rallied around her need. They put in, and when their time comes around, be a lot easier.
Okay, I guess yeah. Oh, we got another. Here. What about people with disabilities and mental health issues who can't leave home and have the kind of reciprocal interdependence as you are discussing? How are they supposed to build this board and get people to fill these places? And if you cannot reciprocate, what does one do?
Mhm. Those are true challenges. And I thank you for bringing them up, because all challenges need to be discussed. So I welcome that question. I think when folks are more homebound, it's even easier to let your circle get smaller. The fact that you are already online with us shows us your willingness to reach out to others, to use the tools that you've got online. Now, I've got clients that that are members of online communities. There's a tremendous amount of online support, not only relative to the disability or diagnosis, but just to aging. One of the folks that writes a book that I didn't put on the slide, Carol Merrick, runs there's a Facebook group called Elder Orphans. And Carol started a Facebook group in 2017 just to see if there was anybody out there. And now there's 10,000 people in that Facebook group. And what they do inside that group is talk about their challenges and solutions, and also provide support to each other. And they talk about their wins and how they do things. There's a lot of chatter on there about housing. How do I find my people? How do I fix my garbage disposal? Here's a YouTube link. They're helping each other on community. And it's not just the Elder Orphans Facebook groups. There are others. People Aging Solo Facebook groups. Just key in there, aging Facebook, aging solo groups, and a lot will come up. From that Elder Orphans Facebook group, there was born Elder Orphans Financial, Elder Orphans Cooking, Elder Orphans Expats. Or maybe your deal is your particular breed of cat or dog. Find friends in those communities and start to kindle relationships.
Mm-hmm. Very nice, very nice. Is there anybody else who wants to drop some questions? We still have 10 minutes. And while Nancy is here, anyway, Nancy, while waiting for, other additional questions, if ever they have, do you want to say anything else to add in general?
I would just encourage folks, if you have a question and it's what I say, not ready for prime time, if you don't want to ask it in front of everybody here, email me, Nancy at nancyruffner.com. I read them all. I will reply. You have my solemn vow on that. You might find a lot of answers on my media, my Facebook group. Download those freebies. Get in my community, because a lot of the answers will come right to your inbox every other Wednesday. But yeah, the stuff we're discussing today is so normal. Your questions are normal. Your challenges, your quest, normal. but doable. That's why I get so excited. I'm not trying to be all Pollyanna about everything, but y'all, we got options. Let's use them.
All right. So we got another question here. Suggestions for making friends with neighbors in a neighborhood with lots of turnover?
Mhm. That's a little harder. You may have to do a repeat or a three-peat. um, we see this in a lot of our military communities. Folks are coming and going. And I myself, I know full well that some of my college friends have remained in touch for all these years. I see them. I need to do that too. I need to get back in that group. I need to find the tried and true. If I see them staying together, I need to put my foot back in that circle because they're already cohesive and and loyal and diligent over time, and that's the kind of people I want to find. So somebody may move away from me, or like me, I moved away from everybody in 2023. I stay in touch with some of those folks, but I got to make new ones too.
Awesome. Awesome. Anyway, I guess that's the final question that we have. All right. Okay. Thank you, Nancy. Anyway, ladies and gentlemen, thank you for thank you all for joining us today for this insightful coffee chat. I learned a lot personally. We hope you found the discussion valuable and empowering, and we're excited to invite you to our next coffee chat, of course. Mark your calendars for the next third Wednesday. So we do this every third Wednesday of the month. Ladies and gentlemen, at 11 a.m., okay? We spend an hour to do this. It's free, and you can always invite your friends, which is, as much as you want, as many as you want, okay? For those who couldn't join us today, or you want to revisit what we've discussed today, what Nancy have shared to us today, we will be sending out a replay link via email. I'll just be editing everything, cleaning up the footage, and then I'll be uploading it in YouTube, and then we will be emailing you that link, as well as the PDF resource that Nancy has prepared. It has the links to different downloads, the books, etc. They're all there. So once again, thank you, Nancy. Is there any final message that you'd like to give our audience?
Just remember that there are options and there are solutions, and this is doable. So let's join hands and do it.
Awesome, awesome. I love that. Anyway, guys, ladies and gentlemen, have a great day. We'll see you again next time. Thank you very much.
Bye,
Bye-bye.
everybody.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights. See you again next third Wednesday of the month.